Feeling tired is common, but some fatigue is your body waving a red flag, not just asking for a nap. In this video, you'll learn how to tell the difference between normal tiredness and fatigue that deserves medical attention. The key idea is pattern: how long it lasts, what makes it better or worse, and what other symptoms come with it. If your fatigue is new, unexplained, or changing fast, that matters. If it's affecting your work, driving, or basic daily tasks, that matters too. We'll walk through specific warning signs like shortness of breath, chest pressure, fainting, fever, and unexpected weight loss. We'll also cover less obvious red flags like depression, sleep apnea, anemia, thyroid problems, and medication side effects. You'll leave with a simple way to track your symptoms and know what to say at an appointment. The goal is calm clarity, not panic. Let's start with the baseline: what normal fatigue usually looks like. Moving to slide 2. Here's a helpful distinction. Tiredness is often proportional to what you did. You slept less, worked late, traveled, or had a stressful week. Fatigue is different. It can feel like your battery won't charge, even after rest. A big red flag is duration. If fatigue lasts more than 2 weeks without a clear reason, it's worth paying attention. Another flag is progression. If it's steadily getting worse, or you're needing more caffeine just to feel normal, that's information. Also, notice timing. If you wake up exhausted most mornings, think about sleep quality, not just sleep quantity. And if fatigue is paired with brain fog, dizziness, or weakness, that combination can point to medical causes. None of this means something scary is happening. It means your body is giving you data. The goal is to respond early, when problems are easier to identify. Next, let's talk about the most urgent red flags. Moving to slide 3. Some fatigue-related symptoms are urgent because they can involve the heart, lungs, brain, or serious infection. If fatigue comes with chest pain or pressure, especially with sweating, nausea, or pain in the arm or jaw, seek urgent care. If you're unusually short of breath at rest, or you can't climb a small set of stairs without stopping, that's another red flag. Fainting, near fainting, or a new irregular heartbeat can signal circulation or rhythm problems. Confusion, new trouble speaking, or one-sided weakness is an emergency, even if fatigue is the main complaint. Also watch for signs of severe dehydration or infection, like very dark urine, inability to keep fluids down, or a stiff neck with fever. The point is simple. When fatigue shows up with body system alarms, don't wait it out. Get checked. Now let's cover a common but overlooked red flag: unintentional weight change. Moving to slide 4. Fatigue plus unexplained weight loss is a combination doctors take seriously. If you lose weight without trying, especially more than about 5% of your body weight over several months, it deserves evaluation. It can happen with overactive thyroid, uncontrolled diabetes, chronic infection, inflammatory disease, or sometimes cancer. Weight gain can be a clue too. If you're gaining weight while feeling cold, constipated, and sluggish, low thyroid is one possible explanation. If weight gain comes with swelling in the legs, shortness of breath, or needing extra pillows to breathe at night, fluid retention becomes a concern. Another red flag is appetite change that doesn't match your routine. If food suddenly feels unappealing, or you feel full very quickly, that's worth mentioning. The goal isn't to self-diagnose. It's to notice patterns that make fatigue more medically meaningful. Next, let's talk about fever, night sweats, and swollen glands, classic systemic clues. Moving to slide 5. When fatigue comes with signs that your whole body is involved, it raises the priority. Fever that lasts more than a few days or keeps returning is one example. Night sweats that soak your clothes or sheets are another. Swollen lymph nodes like in the neck, armpits, or groin can happen after infections, but if they persist or grow, they should be checked. Also pay attention to persistent cough, new rashes, joint swelling, or mouth ulcers, because fatigue can be part of inflammatory or autoimmune conditions. If you've had a recent viral illness and fatigue drags on, that can happen, but the trend still matters. Are you slowly improving or stuck? A practical tip is to write down temperature readings, how often sweats occur, and any new lumps. Specific details help clinicians narrow the possibilities. Next up, anemia and bleeding, one of the most common, fixable reasons people feel wiped out. Moving to slide 6. Anemia means your blood has less ability to carry oxygen, often due to low hemoglobin. It can make you feel exhausted, weak, and short of breath with mild activity. Common clues include pale skin, dizziness when standing, headaches, and a racing heart. One major red flag is any sign of bleeding. Black, tarry stools can indicate bleeding in the stomach or intestines. Bright red blood in stool, vomiting blood, or heavy menstrual bleeding can also lead to anemia over time. Easy bruising or frequent nosebleeds may point to clotting or platelet issues. Diet can play a role, like low iron intake, but bleeding and absorption problems are important to rule out. A simple blood test often gives the first answers. If fatigue is paired with new shortness of breath, chest discomfort, or fainting, treat it as urgent. Next, let's cover thyroid and blood sugar problems, two metabolism issues that often hide behind fatigue. Moving to slide 7. Your thyroid helps set your body's pace. When it's underactive, people often feel slowed down. Fatigue comes with feeling cold, constipation, dry skin, hair changes, and weight gain. When it's overactive, fatigue can look like restlessness, anxiety, heat intolerance, sweating, tremor, and unintentional weight loss. Blood sugar issues can also drain energy. With diabetes or prediabetes, fatigue may come with frequent urination, increased thirst, blurry vision, or slow wound healing. Low blood sugar episodes, on the other hand, can cause shakiness, sweating, irritability, and sudden weakness, especially if meals are delayed. The important red flag is a new cluster of symptoms that points in one direction. These conditions are common, testable, and manageable, but they're easy to miss if you label everything as stress. Next, we need to talk about sleep, because poor sleep quality can mimic almost any illness. Moving to slide 8. If you sleep 8 hours and still wake up exhausted, think about sleep quality. One major red flag is sleep apnea. That's when breathing repeatedly pauses during sleep, fragmenting rest and lowering oxygen. Clues include loud snoring, gasping or choking at night, morning headaches, dry mouth, and daytime sleepiness. It's also linked with high blood pressure and heart risk over time. Another sleep-related issue is insomnia, where you can't fall asleep, stay asleep, or you wake too early. Restless legs can also keep you from getting deep sleep, often described as an uncomfortable urge to move the legs at night. And don't overlook alcohol. It can make you sleepy at first, but it often worsens sleep quality later in the night. If you're nodding off while driving or at work, that's a safety red flag. Next, let's cover mental health and fatigue, because burnout and depression can be real medical issues, not personal failures. Moving to slide 9. Fatigue isn't only physical. Depression often shows up as low energy, low motivation, and a sense that everything takes more effort. Anxiety can also be exhausting because your nervous system stays on high alert. A red flag is when fatigue comes with loss of interest in things you normally enjoy, persistent hopelessness, or major changes in sleep and appetite. Another red flag is difficulty concentrating that affects work or relationships. Burnout can overlap with depression, but it's often tied to chronic stress and feeling emotionally depleted. None of this is just in your head. Mental health is part of health. And it interacts with physical issues too, like thyroid disease, anemia, chronic pain, and sleep disorders. If you ever have thoughts of self-harm, that's urgent and deserves immediate help. For many people, naming these symptoms out loud is the first step toward real support. Next, we'll talk about medications and substances, because side effects are a surprisingly common cause of fatigue. Moving to slide 10. If your fatigue started after a new medication, a dose change, or a new supplement, that timing is a clue. Many common meds can cause sleepiness or low energy, including some allergy medicines, pain medicines, muscle relaxants, and certain blood pressure or anxiety medications. Some medications disrupt sleep architecture, so you sleep but don't feel restored. Alcohol, cannabis, and other substances can also affect motivation, mood, and sleep quality in ways that feel like mystery fatigue. Another red flag is combining multiple sedating substances, especially if you're driving or operating equipment. It's also worth noting that stopping caffeine abruptly can cause headaches and fatigue for several days. The key is not to change medications on your own. Instead, bring a list, names, doses, and when you take them, to a clinician or pharmacist and ask, could any of these be contributing to my fatigue? Next, let's make this practical. How to track fatigue so an appointment is efficient and accurate. Moving to slide 11. If you want answers faster, show up with good information. Start with a simple fatigue log for 1 to 2 weeks. Rate your energy from 1 to 10 in the morning, afternoon, and evening. Note sleep time, wake time, and whether you woke up during the night. Track caffeine, alcohol, and any naps. Then write down associated symptoms, like shortness of breath, palpitations, headaches, fever, pain, mood changes, or digestive issues. Also note triggers. Does fatigue worsen after meals, after exercise, or during your menstrual cycle? Finally, list what you've already tried, like hydration, earlier bedtime, or changing workouts, and whether it helped. This turns a vague complaint into a clear pattern. It also helps a clinician decide what to test first, like blood count for anemia, thyroid labs, blood sugar, iron levels, or sleep evaluation. Next, we'll close with a simple decision guide: when to seek urgent care, when to book a visit, and when to monitor. Moving to slide 12, here's a calm decision guide you can use. Seek urgent care if fatigue comes with chest pain, severe shortness of breath, fainting, confusion, signs of stroke, or severe dehydration. Book a medical visit soon if fatigue lasts more than 2 weeks without a clear cause, is steadily worsening, or comes with weight loss, fever, night sweats, persistent swollen nodes, bleeding, or new heart racing. Also book a visit if you're falling asleep unintentionally, especially while driving, or if snoring and gasping suggest sleep apnea. If your fatigue has an obvious cause, like a short-term sleep deficit, you can monitor it while you rebuild sleep, nutrition, and stress recovery. But set a checkpoint. If it's not improving, don't keep pushing through. Getting evaluated is not overreacting. It's basic maintenance. If this helped, subscribe for more clear, evidence-based health explainers. And in the comments, tell me, is your fatigue worse in the morning or the afternoon? A or B? This information is not a substitute for medical advice.